act like you know up in here. GP.
Joy 99.7 FM.
Put your hands together. Come on.
I need someone, somebody to help me come and turn my life around.
Joy 99.7 FM.
Come on.
I can't explain it. I can't obtain it. Jesus, your love is so, it's so amazing. It gets me high up to the sky. And when I think about your goodness, it makes me wanna slow.
You can't take my joy, devil. Makes me cut.
Makes me clap my hands. Makes me wanna dance and slow.
Oh, you better put them hands together and have a Holy Ghost party with me.
My brother, can't you see? I've got the victory.
Joy 99.7 FM.
I'm more than a conqueror.
We also have a combined, you can hear King Promise in the background there, perfect combination. Combined. And I'm honored to have Dr. Kwame Amponsah-Chiano. He's head of Disease Prevention and Control Department and also the manager of the expanded program on immunization for the Ghana Health Service. An expert in and qualified consultant in public health and many other things. We're glad to have him to take us through these important updates so that you can be empowered, informed, transformed, and of course take part in these programs. Doc, you're welcome.
Thank you.
Been a while.
Yeah, it's been a while.
And you know, when there's no big wahala, nobody wants to talk about vaccinations or vaccines and immunizations, and you do your work in the background protecting all of us.
That's right.
Yeah.
Occasionally we do a couple of announcements and engagements here and there.
Right. But we're good, and we're happy to know that we do have an active and indeed effective should I say, immunization program. We've taken all the opportunities to, should I say, get on board ever since the WHO started the expanded immunization program, and it's been a good journey.
That's very right.
Yeah, and there's so much you do. Before we get into malaria vaccine and all that, just give us a brief overview of what the EPI covers.
Okay, so let me say a big good afternoon to your cherished listeners. And I don't know whether you're on TV as well.
We're online,
viewers.
Facebook, YouTube. They can see you. If you scratch
So-
your nose, they'll see it.
Yeah, viewers alike. So yeah, that was right. You will recall that the WHO started the expanded program on immunization, or should I say launched it in 1974.
Right.
And 4 years after, Ghana picked it up
Okay.
in a pilot form at the time. And then between 1985 and 91, it had been scaled up to the rest of the country. So it started as a subnational program. And by 91, it was covering the whole nation. At the time, it was a 6 childhood killer diseases. Interestingly, some people still think that they are 6 childhood killer diseases because at the time, the communication was apt. But now we are doing 14 vaccine-preventable diseases, 13 for children and 1 for adults.
Okay.
The 1 for adults, I everything you can guess. That's a COVID.
COVID.
Vaccination. It's now part of the routine.
All part of our routine now.
Yes, now for
Okay.
adults. So the childhood immunization program has grown tremendously over the past years, almost 40 years
Mhm.
now, or should I say almost 50 years, because from 1978 to now, it's about 50 years.
Okay. Right. So we've been doing a lot of great work. And just to bring us to speed, Ghana took part in the, should I say, research and indeed the outcomes for the malaria vaccine. And we are part of the rollout.
Yeah, that's right. So our researchers in Kintampo,
That's
and
right.
then also Agogo,
Mhm.
they were part of the initial research that contributed to knowledge, the body of knowledge.
Right.
And then in 2015, WHO floated an advert for countries to apply to pilot a vaccine. At the time, pilot meant that you wanted to see, after the research, how are you able to deliver the vaccine within the routine system.
Mhm.
And because Ghana had been part of the earlier research, we stood a very good chance to be part of the pilot,
Okay.
bringing it into the routine. And so we were successful, and alongside Kenya and Malawi, we started piloting in 2019. So
Okay.
the other objectives were to look at the overall impact in terms of childhood illness and mortality or deaths, and then also to look at, within the context of routine,
Mhm.
what is the safety like.
Right.
For any new vaccine, even if it's gone through the research and all that, once you bring it as a new vaccine, we still have to monitor safety. So we worked very closely with the Food and Drugs Authority on that,
Mhm.
to look at overall safety within the general population.
Okay.
And so those were the three key objectives for which reason we did a pilot.
Okay.
So, and at the time too, because the vaccine was, I should say, one of the very few vaccines that are delivered in 4 doses,
Mhm.
and more so the last dose being in the 3rd year of life,
Okay.
which was unprecedented. So
Mhm.
we needed to study it and see how best we could do that. And we learned a lot of lessons from the pilot that has shaped the rollout. So the pilot actually ended in 2023.
Right.
So we are no longer piloting. It's now part of the
It's
routine.
part of our EPI.
Yes, except that it's subnational, meaning not every region is doing it,
Okay.
but eventually we're doing what we call a phased introduction.
Mhm.
So the whole nation will be covered in the next 3-4 years.
Okay. Folks, if you've just joined us, it's about 14 minutes past the hour of 2 on Joy 99.7 FM. As always, on a Sunday afternoon, you've got me, Nortey by Nature, in the seat, and the program is Ultimate Health. You've just heard the program manager for our expanded program on immunization. He's also head of disease control, surveillance, everything in that basket at the Ghana Health Service. Dr. Kwame Amponsa Achiano is with me in the studio. There's kicking off shortly an expanded or a scale up of the malaria vaccine implementation. We've been piloting it in parts of the country since 2019. We were indeed part of the countries that helped develop this very novel vaccine and protection for, should I say, the world. And we've been piloting it. He'll talk a bit about the objectives and again some of the outcomes. Is it efficacious? Is it safe? And probably you'll assume or you'll agree that it is safe, and that is why they are upscaling it to more and more parts of this country. I do understand that we're hoping to upscale to about 11 out of our 16 regions. Or
Yes, that is right. So, but then a bit of correction.
Okay.
There's a head of disease surveillance.
There's a head of disease surveillance.
Yes, I'm immunization manager.
Okay.
And then head of disease control.
So there's a sub.
Yes, there's
Okay.
a subtle difference.
All right. Okay.
But I need to put it on record.
Yeah.
before,
Okay. No problem.
Okay.
Before he
Yeah.
comes to control you.
No, not really. No,
Just
for-
kidding. But
for
just
the
trying to get
public
people
to
up to
understand.
speed. So these are things that have become part of our routine basket of immunization and protection we provide on a routine basis
That is right.
for our citizens.
Yes. So
Okay.
I would explain 2 things.
Mhm.
First of all, the pilot is not the same as the the, as it were, the vaccine development. There are two different.
Oh yes, yeah, definitely.
Okay,
Yeah,
fine. So,
definitely.
yeah. So we did a pilot in 4 regions when we started in 2019.
Mm-hmm.
It was Volta, Central, Brong Ahafo, and then Upper East. But you agree with me, because of the subdivision, the political subdivisions, we would now say there are 7 regions.
Okay.
So that was in 2019. So
Right.
as we started, then they got subdivided
Mm-hmm.
into Volta OT,
Mm-hmm.
Central, Bono Ahafo, and Bono East, and then Upper East.
Okay.
So 7. So when we're in the next phase, so that was the first phase.
All right.
The next phase now is to add 4 additional regions. So Upper West, Savannah, Western North, and Northern region.
Okay.
So they are coming on board now, and we've gradually done this
Joy
because
99.7
you don't have all the
FM.
resources in the world to go one scale.
Okay.
So we are doing phased introduction based on the burden of malaria.
Okay.
So we work closely with our internal partners who are especially the malaria National Malaria Elimination Program.
Mm-hmm.
They give us a stratification and direct us where the vaccine is needed most.
Okay.
And
Okay.
again, the vaccine is not replacing the existing malaria control interventions.
All right.
So it's just an add-on.
It's an added strategy.
yes,
an
it's an
added,
added strategy.
an added layer of protection.
Exactly. To
Okay.
the indoor residual spraying, the seasonal malaria chemo prevention,
Okay.
and then of course the original prompt diagnosis and treatment,
Mm-hmm.
and then the other intervention, especially the insecticide-treated bed nets.
Bed nets.
So it's not coming to replace it, but it's coming to add value
Okay.
to the existing
Okay.
interventions.
Folks, I hope you can hear me. Sorting out a few technical issues. I also have a commercial block to play so that we can tune, and I hope you can hear Dr. Kwame Amponsa Achiano loud and clear. We'll be back in a second. Stick and stay. Don't go away.
Joy 99.7 FM.
Manchester City are the Premier League champions again.
When it's football you want, get it all on DSTV. All the leagues, all the cups, all the matches live. Because when it comes to football, we've got it all day, all night. No matter what package you're on, you're always going to get football on DSTV, your home of entertainment.
The luckiest,
Star 712 hash.
luck is everywhere, for everyone, yeah.
Here's to the friends who dialed star 712 hash and found no regrets. To the investors who struck gold. To the health workers who diagnosed luck with precision. To the tough guy who couldn't hold back his tears. To the passionate fan who couldn't contain his joy. To the seamstress who turned her hard-earned stitches into a bundle of happiness. And now, here's to you. Your next big win is right here.
Luck is everywhere, for everyone, yeah. The luckiest.
Dial star 712 hash. Now join in the luckiest winning celebration. Every 1st July 2024. Over dial star 712 hash. Now I can to tickets as a group, individual, and now even as a community. Now win is the car prizes are in the community draw or go for the grand draw on the 30th of November 2024. Unlock your luck with star 712 hash. Now join in the winning streak now.
The luckiest,
Star 712 hash.
luck is everywhere, for everyone, yeah. The luckiest.
Oktoberfest is here again. Ghana's premier 5-star hotel and your CIMG Hospitality Facility of the Year, Labadi Beach Hotel, brings you another exciting edition of the biggest beer festival in the world, Oktoberfest 2024. Performer live in Ghana is the Bayern Boys Band from Germany. Catch all the fun with German traditional food and beer at Adessa Pavilion, Labadi Beach Hotel on the 4th and 5th of October 2024. For enquiries and reservations, please call 0249-532-866 or 0244-747-670. Proudly supported by Brussels Airline, Joy FM, and TV3. Oktoberfest Beer Festival. Come, let's party!
gone.
Like smallpox.
Yes, okay. We don't take them anymore. Are we thinking and suggesting and knowing or hoping that there will come a point in time when we can say that of malaria?
Yes, that is why. So there's a whole plan. I wish my colleague from malaria had been here with me, but we've now finished the strategic plan towards the elimination.
Okay.
And so we are hopeful, looking at where we've come from.
Mm-hmm.
The diseases of the burden has gone down, deaths have reduced, and all that. So we think that as Ghana, we could be on the way to eliminating malaria.
Okay, folks.
But talking about elimination, it's totally different.
It's a different thing.
eradication.
Yeah, and eradication.
Yes,
Yeah. Okay.
Smallpox is eradicated, and it's because of vaccination.
Right. And sometimes those who create all the brouhaha about vaccination, immunization, and all these things, they leave these clear details out. All right? Clear milestones and achievements have been chalked, right? Using ancient and developed processes that we now know are efficacious, effective, and the big word is safe. Doc,
Yes.
yeah?
Yeah, so I'm sure we'll be talking about the measles-rubella.
Yeah, we're coming to that.
We'll dwell more on the
Okay.
fact that vaccination has done a lot.
Yes, okay. So we've got a program rollout and a rollout date, okay? But this will vary depending on location, resources, and everything else, right?
Yes, so as I said, 25th. Today is 29th.
Yep.
So 4 days ago or 5 days ago, we designated that day as the official start.
Okay.
So we know that some districts have started, others will come on board. So we've given ourselves up to the end of the year,
Okay.
so that all these 43 districts would have started. And originally, we already are doing 91 districts in the 7 earlier regions that I mentioned.
Okay.
There are 91 districts in all. So we are adding these 43 districts.
Okay.
And then we will be left with about 125 districts more.
Okay.
And we've given ourselves the next 4 or 5 years.
Right. Okay. Your questions,
scale up.
concerns, experiences are welcome. WhatsApp 055 11 11 997. I can see many of you busily typing away. We will activate the phone line shortly. We're live on Facebook and YouTube. This is Ultimate Health on Joy 99.7 FM with me, Nortey by Nature, in the seat. And my guest, we are honored to have the head of our expanded program on immunization, Dr. Kwame Amponsa Achiano, in the studio. We're going through, and we have been rolling out. We've done our pilot, and we're upscaling the implementation of our malaria vaccination program. That's what he's been talking about. It requires that the children from age of 6 months get 4 doses of this vaccine. And he's mentioned some of the ages: 6 months, 7 months, 9 months, and then 18, right?
Yes, 18
yeah.
months.
And the child is required to get the full cover. And it's been synchronized with the other vaccinations that we offer in this country on a routine basis. Okay, I've got this from the gentleman or the caller who was the listener who was asking about my sick tune. Why is mumps not part of the MMR vaccine in Ghana? My kids were born in Europe, but my second child had to be in Ghana at 4 months. The MMR he had here did not have mumps as part of it. He later had mumps 4 years ago at the age of 6 when there was an outbreak in their school. His older sibling did not get mumps. So can we quickly just address this and then?
Yeah, so remember when we started in 1978, it was measles standalone.
Yep.
And so you need to usually, before you introduce any vaccine, you have to gather data. And that is why surveillance is so important. Because it's before and after the introduction, you still have to monitor whether the disease you set out to control is being controlled.
It's being controlled, yeah.
And so we started with measles standalone. And then in 2013, we added rubella because we had been able to gather the data to make a case for rubella. We still are doing that for mumps. You know, there's been outbreaks here and there. But it all boils down to having adequate data to give to, as it were, I mean, to convince the
Right.
policymakers.
Following
to
the
understand.
science.
Yes.
Following the science.
So
okay.
we are not oblivious of the fact that mumps, we've had, as it were, outbreaks, but
Okay.
we need to, as it were, shape the data and then make a case for that.
Right. And these data sets are region and location specific. Right?
Yes,
So
they
you're
are,
collecting
but
data.
usually when
yeah.
we do vaccination, like remember, because of migration, people crisscross and all that,
All
we
right.
don't usually, as it were, segregate and say for this region you are giving.
When I say region, actually, I was talking about looking at the global
the
scene.
global, okay,
So
that's
my-
right.
He,
That's
he
very correct.
mentioned or she mentioned that my kids were born in Europe. So
exactly.
they have their protocol there.
I get it now.
Uh-huh,
Yes,
yeah.
yes,
That's what I was
yes,
trying to
yes,
draw
yes,
attention
yes.
to. Okay, folks, we're still talking about the malaria vaccine rollout, scale up, whatever you want to call it. It's available and it is safe, efficacious, and it protects our children. And we've got it here. Going to be running alongside, in fact, it has been running alongside the other tiers or strata of malaria intervention in our country. It does not displace, replace, substitute these ones. Let's make that clear and emphatic, okay? And so that's there. And then we also want to talk about measles, all right? My understanding is that we haven't had any measles-related death between 2003 and 2021. There have been some, I don't want to use sporadic, but there have been some outbreaks that have hit our attention. Okay, so let's look at what we've been doing for measles, and then, of course, why now we have a combination. That's why I use that instrumental, perfect combi, right? That there's a combination now, Measles-Rubella. Okay, yeah. So let's talk about what we've been doing and what is available for rubella and
Yes,
measles.
so thank you very much once again. I think we started discussing it a
Yeah.
bit earlier.
Mm-hmm.
So in 1978, when the program started, it was measles standalone.
Okay.
At the time, measles was a big problem.
Mhm.
My mom tells me I had measles myself.
Mm-hmm.
And of course, I was born long before that, so I didn't have the opportunity. But as we started, especially the 70s, the 60s, coming up to the 80s, measles was the number 2 cause of death
Mm-hmm.
in the country after malaria.
Right.
And I remember when we were in the medical school, our big professors used to tell us how they got overwhelmed with measles cases on the children's ward.
Exactly.
And you see somebody's child maybe a day before, the next day you come, the child is gone.
Mm-hmm.
And so it was one of the major issues to tackle. And that is why it was part of the 6 childhood killer diseases.
Okay.
Again, as I said, they are
Killer
now-
diseases,
yes,
folks.
at the
Killer
time.
diseases.
Now
right.
it's 14.
Okay.
So fast forward, we in 2012, we signed on to the measles control strategies and all that for African region.
Okay.
And we've been doing quite well. When we started, the coverage for the vaccination was around 50%
All right.
in 1978 towards the 80s. And gradually it's been going up.
Mm.
At the time, we had a lot of measles cases. So as the coverage of the measles vaccine went up, the cases were going down. In fact,
Right.
so beautiful.
So the correlation between our vaccine program for measles
Exactly.
and the
we have a slide that
cases,
we usually
yeah.
use for advocacy.
shows.
You see big bars of measles cases, and then as you look at the immunization coverage
rising.
then
Measles cases are
Measles
dropping.
cases.
Doc, let me, with your permission, announce the phone lines because we've been very detailed. Typically, I activate phone lines about halfway through. 030-221-6541. 030-221-6541. This is Ultimate Health on Joy 99.7 FM. If you just joined us from church, we're talking about vaccinations and the upscaling and rollout of specific programs with regard to measles and rubella, and of course the malaria vaccine program as well. In the studio, I have with me the head of our expanded immunization program, Dr. Kwame Amponsa Achiano. So any questions, concerns via phone 030-221-6541 and by WhatsApp 055-1111-997. This is Ultimate Health.
Joy 99.7 FM.
Okay, so
Yes.
we have a correlation. And
Yes.
you see, when you show
Right.
it graphically,
Yep.
you're actually talking about lives saved,
exactly
right?
exactly.
Lives
So
saved.
I was developing that
Yeah.
point that
Mhm.
So now we are hitting around 90-something%
Coverage. Okay.
And then you see that the bars have, they've reduced in height.
Okay.
And more so when we add what we call the supplementary immunization activities.
Okay.
So when we intersperse them with supplementation, like
Which,
we're about to do
like
now.
mop up.
Yes.
Doing
then
more.
Then the bars even go further flat.
Okay. That's proper science.
Yes.
The relationship is clear.
Exactly.
It's
very,
not
very
any
clear.
spurious placebo
Sure.
or voodoo, anything
Yeah.
that is happening.
So
It is
all
the vaccination.
The deaths that used to occur
Right.
between 2003
Okay.
and 2021, we never saw measles deaths.
Okay.
From 1980, where
Mm-hmm.
measles was about, it was second only to malaria in
Right.
terms of death. And
Okay.
it accounted for about 15% of
So
all
essentially,
childhood
Doc,
deaths.
what we're talking about today is critical, non-negotiable,
Very, very,
life-saving
very, very
interventions.
important. Very, very
right.
important.
Let me just ask this, okay? Is vaccination, all these things, are they free?
Yes, they are free. In fact, governments provide vaccination free of charge for
Okay.
children under 5.
Of course, when we say free, it's being paid for, but you are not. The end user, the end benefits, or the whoever we're protecting is not paying.
That's right.
Right, and we need to underscore this when people start mucking around. Sorry, my
In fact, it's quite
Yeah.
quite a huge
it's a huge burden.
huge investment
Yeah.
that government makes
Mm-hmm.
since the 1970s that I spoke about.
Right.
All successive governments.
And people need to start appreciating this whilst, using the same life that has been protected to argue against clear empirical scientific evidence. Okay? So I intentionally underscored that. Phone line 030-221-6541. That also works. Empirical, right? You can call my guests without any referral. You've got a specialist in the studio at your fingertips. Dr. Kwame Amponsa Achiano. He heads the vaccine or the expanded immunization program of the Ghana Health Service. We've been saving lives. Some of the lives are listening to us now, right? But they do have questions, and that's why we activate the phone lines, and that is why WhatsApp is 055 11 11 997. Okay, coming back to the joint measles-rubella.
Yeah. So you remember I again said that in 2013 we added rubella.
Okay.
Because we had found out that rubella was also a problem.
Mm.
And we had gathered enough data for that. And nobody really worries too much about rubella. Rubella
Okay.
looks very much like measles.
Okay.
Nobody really worries.
Doc, can I just plead with you? We know measles was a top killer way back. Can we just, for the benefit of listeners, what is measles and what is rubella?
Right.
Okay.
So measles is a kind of viral disease caused by a virus.
Caused by a virus. Okay.
Yes. When measles, the virus enters the human body, it causes illness that manifests as rashes.
Okay.
Yes, it's a particular rash.
All right.
And accompanying that rash, you may have sore eyes, what we call conjunctivitis, or runny nose.
Okay.
Some may develop a cough, or may be complicated by
Right.
pneumonia, diarrhea, malnutrition, and so on.
Okay.
And it's a killer.
Right.
Yes.
Which must be properly identified
Exactly.
quickly and promptly.
Exactly.
Okay.
And the rubella looks very much like measles.
Okay.
It's actually called German measles, except that it's a milder form. It doesn't usually kill, but when it affects a pregnant woman, and especially if it's early in pregnancy, the child may be born with congenital anomalies
Okay.
or birth defects, which can be very debilitating.
Okay.
You can have a child who is born with, can you imagine glaucoma, for example?
Right.
A newborn.
Right.
Or with cataract.
Okay.
Or with a small head, or with diabetes. It's pathetic
Okay.
to have such a child. And some even are born with cerebral palsy.
Right.
And so we do that vaccination to protect that child,
Okay.
and not necessarily the mother.
Okay.
And it's usually done before the child, the woman even gets pregnant.
Okay. Doc, what's the science behind moving from, or the shift from, an independent standalone measles vaccine to the combination?
Okay, so
The relationship between the two.
These vaccines may come as different vaccines. You can
Okay.
have rubella standalone,
Yeah.
measles standalone,
99.7
and all that.
FM.
So based on the efficacy and then also the safety,
All right.
you want to go for that vaccine.
Okay.
Now you have a combination
You have a
vaccine.
combination.
Yeah. So why not go for that and save cost and also save multiple injections?
Okay.
That's
All right.
the only
So we
reason.
don't need to jab you several times,
Exactly.
right? We've now got the formulation in a combined form,
Exactly.
and it provides the protection.
But it's not every vaccine that can be combined.
Yes.
That is why.
Yes.
Yes,
That's
so
why I
this-
asked for the science behind it.
Yeah.
We didn't just decide that, oh,
No.
we don't have time, we don't have
Exactly.
needles or syringes or this or staff, and therefore we've joined it. All right. I've got a follow-up question on the mumps. I'll come to that in a second. Phone line is still active, 030-221-6541. Ultimate Health on Joy 99.7 FM. We're doing some very important should I say, education, transformation, and providing information on these very critical interventions. If they were not there, it will be a totally different picture that we're talking about. Phone line active 030-221-6541. WhatsApp active 055-11-11-997. We're live on Facebook and YouTube. And we're talking to Dr. Kwame Amponsa Achiano, the head of our expanded program on immunization. This one says, thank you, Ni. A follow-up, please. Back to the MMR. Why is it called MMR?
Okay, so it is called MMR. It's just an abbreviation: measles, mumps, rubella.
Rubella.
But what we use here is MR.
Okay.
Measles, rubella.
Rubella. Okay.
We don't have MMR.
Okay. All right. So you'd already accounted for the M, which was missing.
Yes.
And Doc educated us on that and the work they are doing to build up the databases for its implementation. All right. So, yeah, we're still on Ultimate Health. Coming back. So this is also coming up on your program schedule.
That's
the,
right.
The measles, rubella.
Yes, remember we've already discussed that measles and rubella vaccine combined are already in
Already there.
the routine.
Yeah.
So based on what we discussed earlier, is that when we do supplementary immunization activities, we reduce measles further.
Okay.
So as part of the plans to reach elimination stage of measles, one of the key interventions is to do regular supplementary immunization.
Okay.
Apart from the routine. So
All right.
there are three strategies. Routine immunization, try and achieve
Okay.
at least 90%,
All right.
and then support it with supplementary immunization activities.
Okay.
Also try and achieve 95%
Okay.
minimum, and then do the surveillance.
All
so
right.
three key things.
Okay.
And of course for rubella, also look at rubella, what we call the congenital rubella
Okay.
surveillance.
Quickly, I have Matilda on the line. Sorry, Matilda, I kept you. Hello, good afternoon.
Hello, good afternoon.
Yes, you're welcome, Matilda.
Thank you. This week we had a message from one of the facilities where I take my child to weigh in, and they were talking about the measles rubella campaign, which will start on 2nd October.
Right.
And they are saying that even if your child has already had the vaccination, they have to do it. And when my child was 9 months, I bought the MMR for her,
Okay.
and she'll be due for the next one in November. So should I still let her take the measles rubella again before the one in November?
Okay. All right. So she's asking that. Well, she's been following. Her child has already had the jab. The next one is due in November. She's been told by the health officials that there's a program kicking off in October, and she's asking, despite what the child has already received as cover, should she take this one? What would you say, Doc?
Yeah, the answer is yes.
Okay.
Irrespective of whether the child has received the vaccine in the routine or not, the child is eligible
All right.
for remember,
There's
this
the-
is supplementary
Supplementary.
immunization activity.
Can I dare use the word booster? Is it the same thing? Are we boosting the protection?
It's in I mean in the layman's language maybe yes, but
Okay.
for science a booster is a bit different.
It's a bit different. Okay.
But I would say, I mean, for local language, we say yes, okay.
Okay.
To boost the immunization.
All right. So nothing
But it's
untoward.
supplementary.
Supplementary.
Yes, you are adding.
Adding. All right. So
onto
nothing
that.
untoward will happen to this child.
Not at all.
Okay. So you'd advise that she go ahead.
Yeah, we don't encourage double vaccination within that week.
Okay.
That week is, as you rightly said, from 2nd to 6th October. That's when we are doing the supplementary immunization activity for all children under 5.
Okay.
Irrespective of whether they received previous doses or not.
Okay.
And so that during that week, we don't encourage double vaccination.
Okay.
That's all. But if the child had received that previously, it's okay to receive the supplementary.
Okay. Let me whip my thoughts back again. So who should be receiving these interventions? And I'm asking with respect to the malaria that we discussed earlier, and of course the Measles-Rubella.
Okay.
Who are the target group? Who should be going? You just mentioned under 5s, but can we explain that so that our listeners understand?
Right. So we are dealing with two very different implementation strategies.
Okay.
For the malaria vaccine, it's a routine vaccine.
Mm-hmm.
So we are not setting aside any dates
Okay.
for that.
It's
except
routine.
That it's routine.
Okay.
So as and when the child is due
Okay.
for weighing, as it were,
All
that's
right.
what the caregivers understand more. They take the child there.
Mm-hmm.
The nurses will use their algorithm
Yeah.
or flow chart and
Yeah.
check whether the child is due for. I mean, how old is the child? Is the child due for malaria vaccine? What are the other vaccines that the child is due for? They will give all,
Okay.
counseling the mother and so on, and to return.
Okay.
That's for the malaria vaccine. For those that are just going to introduce, starting in the 4 regions,
Right.
they are going to consider children who are 6 to 11 months.
Okay.
They will all be due. And so anytime they come, they would check and then give them.
Okay.
The measles rubella is different.
All right.
For that one, we are looking at all under 5s within a limited time.
Okay.
So from 2nd to 6th. If you miss it, you've missed it.
Okay.
Until maybe the next 3 or 4 years when we are
Okay.
doing another SIA or supplementary immunization activity.
Okay.
So that one, all children
Under 5.
under from 9 months, I should say, up to just before they are 5 years.
All right.
So it's under 5, but starting from 9 months, that's when they are due
Okay.
for this supplementation.
Okay, right. So all parents, everybody, in fact, the general public, and particularly some of these schools and preschools and things, they
Yeah,
should be aware of
Yeah, in
this
fact, we are
information.
working very closely with the Ghana Education Service and
Okay.
then of course, the Ministry of Education and their structures, and then even the
Okay.
private schools.
Right.
We are working very closely with all of them on that, because that's where quite a chunk of the children will be found.
Okay.
The creches, the
Right.
kindergartens.
So these things are being offered. These interventions are available at facility level, or are there? We know sometimes for certain things there's house to house or institution based and so on. What's the methodology?
So for this one, as I said, the malaria is just the routine things that we do.
Okay, so
that
you go
we'll
to a
put that
center or a
aside.
site.
Yeah, here we would expand the sites. The malaria, the measles rubella
Okay.
would have additional sites. So
Okay.
apart from the health facilities,
Mm-hmm.
we will move to the schools,
Okay.
the creches, and
All
so
right.
on. Would also station in, say, the lorry parks,
Mm.
the market areas, and so
Okay.
on. They are more or less. Some of them are outreach sites already,
Okay.
where community health nurses and other healthcare workers move regularly to vaccinate children. So they set
Okay.
their camps there
Mm-hmm.
and then vaccinate whoever is eligible and is brought. And so on. So
Okay.
it's more like what we do, by a little modified, because we would expand that.
We've expanded
to
that.
schools,
All right.
to lorry parks for that period.
Okay.
That we will be doing the
Okay. I do hope, and
vaccination.
I guess I'm not speculating, but the information vans and all the information and posters should be there for people to get information.
Yes, so-
How do I identify these teams? Because sometimes funny people go out and say, we are doing this. And they enter your house or your station and lorry station. Is there any way by which we can identify these? Hold on to that. I have Hayford, I believe, in Bato. Is it Hayford in Bato? Hello?
Yeah, good afternoon, Nortey.
Good afternoon. Is this Hayford? Who's speaking? Go ahead. Your line is a bit bad.
I said it's Hayford.
Yes, go ahead, Hayford.
I would like to ask a question about this vaccination. The question is, what is the duration at which a vaccine ends in a child?
What is the duration at which a vaccine does what?
End at the child life.
You repeat that. I'm hearing ends a child's life and duration.
I said, what is the duration at which the vaccine ends at the child life?
I'm not getting what is the duration at which the vaccine ends at a child's life? Is that right?
Yes. The duration at which the vaccine will finish working at the child's life.
Okay.
The reason why I ask this is that sometimes you see some of the children, when they grow up, they need signs that the doctor has talked about. Some started showing on the kids.
Okay.
I'll be asking the question.
Okay. All right. So I think he's saying that what's the cover? Some kids have this protection and the vaccinations, but later life they develop or they get some of the signs and symptoms you're talking about.
Yeah, that is why it's even important to do the supplementary. You see, vaccines are not 100% effective. All right. You give the chance for the child to get protected as much as possible.
Okay.
Any vaccine, so once the vaccine is classified as good to go by Food and Drugs Authority or other stringent regulatory, as it were, regulatory group, we go for it.
We go for it.
So it's more of you balance the benefits against the risks.
Okay.
So the measles vaccine, for example, is very, very efficacious.
Okay.
But you need, for the routine, you need the two. The first dose, the second dose, to give the chance the child the best chance.
The best cover.
Exactly. Cover.
Okay.
And then you add the supplementation.
All right. Okay. I've got Monica in La Paz on my line, I believe. Hello, Monica.
Yes, good afternoon.
Yes. How are you?
I'm fine, thank you.
All right. Share with us.
Yes, please. I'd like to know whether the anti-malaria vaccine is ongoing in Accra. Because I have a granny who is going to turn 2, but I don't think we've been given any anti-malaria vaccine.
Okay. All right. Is it available in Accra?
Not yet.
Okay.
You remember we said that we are now doing in 7 regions. We're adding on 4 other regions.
Okay.
Upper West, Savannah. Okay, so let me go back to the 7 regions.
Okay.
Oti, Volta, Central, Bono, Ahafo, Bono East, and then Upper East.
Okay.
And remember, again, we said that we are doing that based on the breeding.
Okay.
Okay, we don't have all the resources in the world to go at.
So where we feel there's
exactly, and we are working closely with the National Malaria Elimination Program, who do that stratification and advise that these districts are also very, very, in terms of burden, very high.
Okay.
And then the next phase is Upper West, Savannah, Northern, and Western North.
Okay.
Accra and the other regions, so there will be 5 other regions left.
Okay, right.
Or 5 remaining regions. They will come on board. Remember, we said that we've given ourselves some period.
Joy,
So that they will come on
99.7
board in a
FM.
phased manner.
Okay.
So to answer the question specifically, Accra is not yet on board.
All right.
But they will come on board later.
Okay. So that means that it's not that you've missed something. The program rollout is informed by certain indicators that they are following, and they will duly get to Accra. All right. So your child here will not have the opportunity yet, but it's part of the programmed response subsequently. Yeah. Okay, great stuff. Believe it or not, it's already 3:00, and we've gotten good information, Doc. What is the most important thing you'd want to leave my listeners with regard to these 2 interventions upcoming?
Yeah, I think for now, I would say that next week, so on the 1st of October, we are already even in the week. Today
right.
marks the beginning of the week.
Yeah.
So on Tuesday, we'll do the launch of
Okay.
the Measles-Rubella vaccination exercise. That's the campaign,
All
which
right.
will last just a few days.
Right.
Second, we take off, and then 6th officially will be the end.
Okay.
And so we encourage all caregivers who have children below 5 years to make their children available.
Okay.
We are adding vitamin A supplementation as well, which is also very important.
Very important.
Important child health
intervention,
prevention strategy.
Okay.
And so we are combining this, and they should make their children available for the healthcare workers to attend to them.
Okay.
Again, you asked how would they be identified? These are people who are known in the community.
Okay.
It's not house to house.
All right. It's not house to house. Okay.
Number 2, we will use the regular outreach points.
Okay.
And also the service delivery points, like the facilities.
Right. So and sites and locations known
and
to
then
the
they will be
indigents.
These what we call the vaccine carriers. I mean, you don't just go to the market and buy vaccine carriers. So they will carry that, plus a yellow box where they usually dispose of the waste, syringes and needles.
Okay.
Some of them may be wearing aprons, but we don't have aprons for almost 10,000 vaccinators.
Right. Yeah. That's a lot of work. All right. I believe we've got all the information. There was something I was going to ask you. It just suddenly slipped me. We have emphasized that this is free. You're not paying for the vaccination.
It's free of charge.
Right?
Yes, government has already paid for it.
Okay. And
it's paid through your taxes.
All right. All right. So we paid for it. All right. So make sure you get the cover. Exactly. Right. The thing I wanted to ask quickly, though we crossed time, I think is very important. Is there anybody or any child, right, who should not receive these vaccines? Are there any contraindications, anything that says if your child has X, Y, Z, they should not be presented for vaccination?
In fact, for the Measles-Rubella, because it's been in the system already.
Okay.
First of all, the only absolute contraindication to vaccination is when a child has reacted to a previous dose.
Okay, if your child has previously reacted.
Absolute.
Okay, and we need that feedback to the system.
Exactly, absolute.
Don't just hide it in your house and say, Menko.
And
right.
reaction is not the same as adverse event.
Right.
Not necessarily so.
Okay.
We are talking those who have had allergic reaction.
Okay.
Allergy, meaning that they have been primed and that if you give a second time. But for the fever and all that, these are normal, I would say,
transient.
Exactly.
Temporary.
They are transient and they don't
okay. All right. So thumbs up. It is safe. It is available. It is free. And it works. All right. What other reason do you want? All right, to take it. Right. Many. In fact, immense thanks to Dr. Kwame Amponsa Achiano. He's very difficult to get because he's very busy and he likes to do his work quietly in the background. So when you see me yank him into the studio, then it means I've had to use some muscle, but he's here for good reason on your behalf. Many thanks, Doc. And we'll come back once more some other time to check on how we collate our data. Right, to be able to say it is doing this, it didn't work, and to be able to even give data and say this percentage or this level of coverage and so on and so forth. We're most grateful.
Yeah, thank you very much. We don't take this for granted.
Yeah.
We are all working to achieve the same aim of protecting our children.
That's right.
And I'm very happy that
right.
able to make
thank you so much. Thank you, Eleanor, also at Health Promotion, and of course my discerning listeners, and of course my new producer Ziggy Bedu is my new producer. Abeku is out there, but hey, he's still part of the Ultimate Health family. Stick and stay on Joy 99.7 FM. I hope you have been informed and ultimately transformed. Stay. Don't go away.
Joy.
Are we good to go? Okay, so take mine as well. Yeah, can it?
Cause every time I hear the joy in there, why is for yeah. Cause every time I hear joy, I say every time I hear the joy, I don't wanna turn off my radio. Every time I hear the joy, I don't want every time I hear the joy, I don't wanna turn off. Every time I hear the joy, I don't wanna turn off. Hello, this is Morris, and I say keep on listening to Joy 99.7 FM.
99.7 FM. Joy, not joy. 99.7 FM.
Hello, this is Morris, and I say keep on listening to Joy 99.7 FM.
Now this one dedicated to all girls around the world. All Jamaica love you like diamond and pearl. Girl like Andy and girl like Cheryl. Here it is, come cross.
Days gone by,
baby love.
I know what we shared was tried and true. But no matter what dark times, yeah, you'll always be there for me. Yeah, yeah, because you are my sweet honey.
Well, if you know, sweet honey, me tell her she had the girl for me. On a road I run her down, picture sexy body, sweet honey. Me tell her she had the girl for me. Rouse me back in at the night, I'm on inside me tea because she's sweeter than the honey that come from the beach. She have my heart, me soul, me whole life intact. Every man want to know how wish she have home, but me I just the agony which she give, you know it can't done. The good food which she cook, you know it can't done. Me say her feelings for me, you know them can't done. Sweet honey, me tell her she had the girl for me, them type of girl, yeah, you love until it turn it to sing out.
Time marches on, but all of her fears still going strong. Looking at your lovely face, it could stop any man in time and space. But even if I had to walk through danger or sail the roughest seas, yeah, yeah, I'm gonna get my sweet honey.
Hear me now. Some man have the dollar, some have the jewelry, but them still can't take away my sweet honey. Cause them a walk up to me girl and chat about them is the done. But she tell her mama man them can't go get some ambition, because the only thing she need is love and affection. And when she express her love, only I can understand sweet honey. They tell her she had the girl for me, you can't impress her with no car nor no diamond ring. Sweet honey, they tell her she had the girl for me, a very decent woman who don't walk about the
So baby,
street.
just walk with me,
Young girl,
and we'll go to that special place in ecstasy.
well check it out.
I finally come to realize that you're the one for me.
Ding ding ding.
You know you are my sweet honey.
Hear me now, she and me baby. Such a lovely lady.
La 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 la.
Always want her beside me.
Want her beside
True
me.
love, you can't deny me.
You know we can't deny
Because
me.
me feel it inside me.
Feel it inside
Destiny,
me.
it's up to guide me.
No, it's a big
Don't rush yourself, just take it easy.
Just take it easy.
Cause nothing else could ever please me except my sweet honey.
Sweet honey, sweet honey, sweet honey, sweet honey, sweet honey, sweet honey, yes. wanna hurt nobody. You only live once, they told me. You can't be mad at me, but I can just be cheap. Even though I got my own CD, maybe even on TV, there ain't no change in me. I can only be me, me, me. Though I might be on TV, cause I got my own CD. All you will ever see, same OG. I used to be the main one clubbing, but now I choose to stay at home. Most of my friends still thugging, but this time the G's were grown. I'm thinking about my future lately, whatever that may be. But now it's clear to me, I can just be G. Even though I got my own CD, maybe even on TV, there ain't no change in me. I can only be me, me, me. Though I might be on TV, cause I got my own CD.
As I walk through the valley of the shadow of death, I take a look at my life and realize there's nothing left. Cause I've been blasting and laughing so long that even my mama thinks that my mind is gone. But I ain't never crossed a man that didn't deserve it. Me be treated like a punk, you know that's unheard of. You better watch how you're talking and where you're walking, or you and your homies might be lying to chalk. I really hate the trip, but I gotta low. As they croak, I see myself in the pistol smoke. Fool, I'm the kind of G the little homies wanna be like, on my knees in the night, saying prayers in the street light. Been staying most of the night, living in the gangster's paradise. Been staying most of the night,
like that, yeah. Come on, bring the chorus in. I do a bid, lose a rib, bust a cap, trusting that. Run up the heaven doors, exchange my life for yours. Leave a stake out the door, mi casa, su casa. Just remember to turn the lights off in the hall. My brother from another pop, -1 shot. We need no G money, man, we all we got. From the stoop to the big dudes, stopping us from playing hoops. And us getting mad, throwing rocks off the roof, straight thugging, man. I thought we would never progress. But look at us now, man, we young execs. My nigga Dame, my nigga Biggs, my nigga Ty, my nigga High, my nigga Gotti. We your body, all is right with the world. No matter how pretty she is, you never like it, my girl. That's how I mind it.
Just the two of them alone.
99.7 FM.
Found someone who could live my life for. Don't wanna be a player no more. I think I found someone I could live my life for. Listen, girl, I'm yours, you're mine for sure. I had enough of running wild. I'm switching up my whole lifestyle. I don't wanna live the way I used to. I'm giving up the booty calls, spinning seas at the top bars. No leaving with 2 or 3 girls to hit me off. See, all I need is one who's really down, someone to turn this player's life around. Girl, I feel like you could be the one to make a difference in my life. 'Cause I'm tired of living trying. I don't wanna be playing no more. See, I think I found someone I can live my life for. Don't wanna be a player no more. See, I think I found someone I can live my life for. I'm yours, you're mine for sure. No rolling with an entourage, celeb style like a movie star. Sipping down with the ladies all around me. Rapping girls off at the wee hours of the morning, getting beeps from a lot of body. A true player never gets a chance to sleep. No, all I need is one who's really down, someone who's really down, someone to turn this player's life around. Oh, girl, I feel like you could be the one, baby, to make a difference in my life. Yeah, 'cause I'm tired of living trying. Player, don't wanna be the player no more, no more, no more. I found someone I can live my life for. I don't wanna be, don't wanna be a player no more.
Joy 99.7 FM.
If tomorrow is Judgment Day, sing, mommy, and I'm standing on the front line, and the Lord asks me what I did with my life, I will say I spent it with you. It's alright. If I wake up in World War III, I see destruction and poverty, and I feel like I wanna go home. It's okay if you're coming with me. It's alright.
Have you both on Sports World? Go and enjoy the match. We're ready for kick-off shortly. Let's head to our commentary game. George Addo, I'll be back with you at half-time. Our commentary game, though, our commentary team at Old Trafford. The former Everton midfielder Leon Osman is alongside our football correspondent John Murray.
John Denver, Manchester United with Anana in goal, Mazraoui, De Ligt, Martinez and Dalot. Then in midfield, Menu and...
Just hearing BBC there, and it's a big game between Manchester United and Tottenham Hotspur. A big game. United need to respond. You listen to Sports Arena, and we're going to bring you first half of that game, and after that we'll return here to have a little chit chat and bring you the second half. So we've got a lot to do today. So many Ghana Premier League games underway, even at the University of Ghana Stadium. Legon Cities and Karela. Legon Cities down by 1-0. And Hearts of Oak also engaged in a big game in Kumasi in the Ashanti region and against Nations FC. We'll bring you updates on that. Likewise, Kotoko against Brecum Chelsea. So much happening today, and we're going to bring you updates on all of that. As the show goes on. So stay with us here. My name is Razak Musbao, and Manchester United versus Tottenham Hotspur is what we've got for you. First half commentary.
And 2-goal Dominic Solanke up front. Manchester United get the match underway. They kick off. They're attacking towards the east stand to our right. Long ball forward towards Xerxes, who can only head it on into the hands of goalkeeper Vicario. So Manchester United against Tottenham. We do have a choice of listening for you on BBC Radio. The Premier League is here on 5 Live. The deciding one-day international live from Bristol is on Sports Extra right now. The ball-by-ball commentary. Australia chasing 310 to win. What's the latest, Nikesh Rugani?
Well, it has just started raining. The rain that was predicted is falling down really heavily, with Australia 165 for 2 in the 21st over. If it was to finish now, Australia would win the series. They're well ahead of what they need to be on Duckworth Lewis. 165 for 2 in the 21st, and they've just gone off for rain.
Okay, right. So Nikesh will keep us updated on the weather forecast in Bristol as the hours unfold. It is 0-0 and Tottenham are in possession. And Steve's been talking about big coats. Well, Big Ange has got a big coat today, and he's got his hands buried in the pockets of it. Ange Postecoglou on the edge of the coaching area. 2-2 draw last season in his first visit here as the Tottenham manager. Tottenham attacking down the right-hand side, headed away by Mazraoui, headed further away on the edge of the area. And Xerxes goes into the challenge centrally with Van de Ven, Udogie. Now here there is Timo Werner on the left-hand side. Werner flicks it forward, bounces off Mazraoui, bounce back for Tottenham on the edge of the box, but it's worked away on the edge of the penalty area. And then Bruno Fernandes on the turn, but he's given it away. Solanke nipped it back from him, and Spurs go back towards the halfway line with Pedro Porro. So Spurs will start again there. In fact, the ball through the middle. Look, Kulusevski looking for the turn. He very nearly got away there, Leon from Ugarte, but it just ran away from him. And as it's played away by Dalot. That was last-minute stuff, and indeed it's been lost now by Martinez. Tottenham drive it on. Ball comes across, and it's stopped there with the right foot of Dalot, and Manchester United are able to get it away, living dangerously early. But a ball now forward for Garnacho. Udogie is able to come in on the tackle. Rashford's heavy touch. That means Van de Ven has now got space. Van de Ven racing forward with the ball. He's still going to Tottenham central defender. He's into the penalty area. He pulls it across, and Tottenham score. What a run from Van de Ven! And tucked away from point-blank range by Brennan Johnson. And Spurs lead in the 3rd minute here. But that was all about the run of Mickey Van de Ven. That was something else. Manchester